I'm Christy. I used to smoke cigarettes. I had smoker's cough and severe shortness of breath, and I knew I had to quit. Then I tried e-cigarettes, but I just ended up using both. I really didn't start to get better until I quit smoking completely. My tip to you is, just cutting down on the number of cigarettes you smoke isn't enough.
Smoking even a few cigarettes a day is dangerous. You can quit. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
Hello and welcome to Healthy Living with Tobacco-Free Allegheny. I'm Joyce Petro. Most people know that smoking causes cancer, heart disease, and other major health problems. But smoking during pregnancy causes additional health problems, including premature birth, certain birth defects, miscarriage, and infant death. According to the U.S. Centers for Disease Control, approximately 10% of pregnant women reported smoking during the last 3 months of their pregnancy. Today on Healthy Living with Tobacco-Free Allegheny, we'll be talking about smoking in pregnancy. Joining us are our guests, Sue Harshbarger, RN, MSN, who's a nurse educator and tobacco treatment specialist at St. Clair Hospital. Also with us is Deborah Kars, RNC, MSN, clinical instructor at Robert Morris University School of Nursing, and registered nurse and community educator at St. Clair Hospital. Welcome, Sue and Deb, and thank you for being with us today.
Thank you. We're happy to be here.
Thank you.
There are so many misconceptions about tobacco use during pregnancy, not only by pregnant women, but also by healthcare providers. Could you describe the health effects of smoking by pregnant women?
The health effects on a growing baby can be really quite profound. These include not only some of the things you just mentioned, Joyce, but also ectopic pregnancy, which is pregnancy outside the uterus, miscarriage, the premature birth, low birth weight, and certain birth defects. Babies who are born too early are more likely to be sick and need to stay in the hospital longer. I have often heard a lot of moms say that having a smaller baby will make delivery easier. And this myth really scares me. The fact is that an underweight or a premature baby is at a much greater risk to be sick and to need extra care after birth. An estimated 5 to 8% of premature deliveries and 13 to 19% of term low birth weight deliveries are linked with smoking during pregnancy. In addition, about 23 to 34% of all sudden infant death syndrome, what we know as SIDS, and 5 to 7% of preterm-related infant deaths are related to maternal smoking. The risks are quite significant for a mom who smokes during pregnancy.
Deb?
Sure, and I would like to add from the perspective of the placenta as it grows during pregnancy. When the baby is born, we oftentimes see a smaller, less healthy-looking placenta when the mom delivers. The placenta and the umbilical cord is what we consider the lifeline to the baby, and that's how our baby gets nutrients and oxygen and grows to be healthy and strong. The poisons and chemicals in tobacco can be transferred directly from mom into baby via the placenta. So when a mom smokes during pregnancy, we can oftentimes see those changes in the placenta. It's usually smaller, and the umbilical cord and blood is often darker and discolored. And that's because of the tar, carbon monoxide, and other chemicals that were transferred from the cigarette smoke. Smoking during pregnancy also increases the risk of having the placenta separate from the uterus too early. Speaking from the perspective of a nurse in that situation, this is a very dangerous situation that can be life-threatening for both the mom and the baby. When the placenta separates too early, the baby's blood and oxygen supply is immediately cut off. There can be very serious blood loss, even severe hemorrhaging for the mom. It's a very dangerous situation.
Sue, can you tell us what are the benefits for a woman of quitting smoking during pregnancy for both her and the baby?
Well, the benefits of quitting are both wonderful and immediate. After the last cigarette, carbon monoxide levels begin to drop, and this means that oxygen levels are beginning to rise. And this is good news for mom and for baby, because this means your baby is getting more oxygen. Oxygen gives your baby the energy to grow. We like to say, Deb and I often like to say, that the oxygen is what helps to make your baby happy and healthy. The best time for a woman to quit is as soon as she finds out that she is pregnant, but there's really benefits to quitting at any time during pregnancy.
Deb?
Thanks. I would also like to add that if someone is planning on getting pregnant, it would be beneficial to consider quitting smoking even prior to conceiving, because of course the healthier egg produces then hopefully a healthier baby. We do know there are many studies out there that show that there's a significant amount of brain, liver, and lung growth that occur in the last few weeks of pregnancy. And because of the risk of preterm birth and preterm labor that is oftentimes associated with smoking during your pregnancy. We would love to keep that baby in there as long as we can, to keep that brain and liver and lung capacity growing. So if we can prevent preterm birth by prevention of smoking during pregnancy, we would love to see more of that.
And there are many benefits for mom too. Long-term benefits of quitting smoking. You reduce your risk of heart disease. You reduce your risk of stroke, emphysema, cancer. So many benefits to mom. Also, risk of diabetes is reduced. Long-term benefits for mom are great. Short-term benefits are also there. Mom will be able to breathe better. Mom will have more energy. And these are all benefits to mom as she goes through her pregnancy. So quitting early in pregnancy is certainly the goal. Even prenatal, before you get pregnant, would even be better. But while quitting early is the very best thing you can do for yourself and your baby, there are still big benefits for your baby to quitting early, even in late pregnancy. It is never too late to quit.
So, Sue, how would you advise a woman who thinks that she smoked during her last pregnancy and had a healthy baby, so it's okay to smoke during her next pregnancy too?
Well, Deb and I encounter this a lot in some of the work that we have done together. And I think it scares both of us when we hear a woman say that, because we always say to them, every pregnancy is different, every baby is different. And good outcomes from a previous pregnancy don't often necessarily guarantee good outcomes from this pregnancy. Also, a lot of the effects, the health effects that you would see from tobacco smoke, from a mom smoking during pregnancy, those health effects aren't always visible and not always apparent at birth. We do see some long-term effects. The first year, there's a greater risk of colic, ear infections, sudden infant death syndrome. We also see longer term, there might be some learning disabilities and other issues that come up.
The other thing I like to remind those moms, which is kind of funny but true, is they're older, so their bodies may be less healthy. They're trying to accommodate a pregnancy in a phase where they're probably a couple years older than they were with that first pregnancy. So every pregnancy is different. I would agree with Sue, and the best thing to do is quit.
Are there dangers for a pregnant woman being exposed to secondhand or third-hand smoke, Sue?
Yeah, most definitely. Pregnant women should not be exposed to secondhand or third-hand smoke. Third-hand smoke is the residue that's left behind from secondhand smoke. It's what you would see perhaps on a window of somebody who was a smoker. You may have that thin film of yellowish or sticky material. That is third-hand smoke. And that is we see that very prevalently in fabric, in carpets, upholstery, and so anyone sitting or touching those items would be picking up those toxins, those chemicals, and then could be transferring it to their skin, to their lips, and ingesting intentionally ingesting some of those materials. The dangers to baby from secondhand smoke are very similar as to if mom was smoking herself. So even when mom does not smoke during pregnancy, if her partner or a family member or her friends smoke, she is exposing her baby to the same risks, such as low birth weight, premature birth, placenta problems, and also longer-term problems such as asthma and other respiratory conditions. So we definitely would like mom to avoid others who are smoking. The best way to protect mom and baby, if you are a family member or the spouse, father of the baby, we definitely would say the best way to protect mom and baby is to quit. But if quitting is not an option right now, then absolutely no smoking around mom-to-be, no smoking in the house, and no smoking in the car.
Okay. Could you describe issues related to tobacco use, whether it's by mom or second or third-hand smoke, such as sudden infant death syndrome and safe sleep, Deb?
Sure. So Sue mentioned not to smoke around the pregnant lady as well as not in the house and not in the car. And sometimes what we don't think about is those toxins that Sue was talking about. Where do they go once that cigarette smoke is emitted into the air? So when you think about if somebody was to smoke in a car and those toxins get on the car seat, then when that baby's in the car seat, they're breathing those toxins that are there. And what we know about safe sleep and sudden infant death syndrome is that unfortunately Pennsylvania ranks really low. We're 31st out of 50 states. There's an initiative coming up in the next year to really look at what we can be doing differently. One of that, probably most important things that comes from that, is that we need to educate folks about what that means. We know that smoking definitely increases the risk of sudden infant death syndrome. And when we look at the risks with sudden infant death syndrome, they compound. So if you smoke, that's one risk. If you work in a job that you're exposed to chemicals that are potentially harmful, that's another risk, and they just build. So if we can take that one risk factor away of smoking, that significantly changes that person's risk. The other things are those toxins that I was talking about. If they embed in the material, in the bed, in the car seat, whatever it might be, then what happens is when the baby breathes those toxins, that becomes harmful. The other thing is if it's an active smoking situation, those toxins and the carbon monoxide that's released then replaces the healthy oxygen in the red blood cell. And so what happens is, this is kind of interesting, we all have that ability to fight or flight. So if I was to reach over and grab Sue's shirt, she's either going to want to run or probably push me away or hit me. Babies have that, they're born with that. But that's when they have a fully functioning, healthy oxygen capacity. When we deplete that or we replace that with other things, such as the chemicals and toxins from smoking, that sort of turns that off. And that's what they've discovered with sudden infant death syndrome, is that they think there's this component where the baby can't respond in a fight or flight situation. So again, if we take that risk away, then we're allowing that brain to be healthy, have good red blood cells, good oxygenation to them. So hopefully if the baby got into a situation like that, then it would be able to alert you. It would cry, it would struggle, it would do something. So we definitely know there is a link, and I know the folks here in Pittsburgh that do work with sudden infant death syndrome would say that it's more often that when they're upon a scene with a sudden infant death syndrome situation, smoking is oftentimes related to that. So if we can get that to stop, that would be wonderful. I would also add, and Sue may address this later, vaping and e-cigs and the toxins that are produced from those, and to consider those as secondhand and thirdhand exposures as well. So all of those things, we're coming to learn more about those as well.
Thank you. We're going to take a break. We'll be right back on Healthy Living with Tobacco-Free Allegheny with Susan Harshberger and Deborah Kars of St. Clair Hospital.
My name is Amanda. I work with women who are trying to quit smoking, and I have some tips for you in case you're pregnant or thinking about having a baby. First thing is, keep trying to quit, or better yet, don't start smoking. It can cause premature birth, which can then increase the risk of your baby having developmental delays, problems with eyesight, breathing, and more. So don't give up. There are people like me who are here to support you, because I know what can happen if you don't quit. Your baby could be born 2 months early and weigh only 3 pounds. She could be in the NICU for almost a month, put in an incubator and fed through a feeding tube that goes through her nose down into her little stomach. I know that because I smoked while I was pregnant, and that's what happened to my little baby. I quit. You can too. For free help, call 1-800-QUIT-NOW.
A message from the U.S. Department of Health and Human Services and CDC.
My name's Mark. What's your daily routine? Get up, feed the kids, shower, and go off to work? Yeah, that was my routine. But I smoked too. And then I got rectal cancer. So my routine became tests and more tests, ultrasounds, CT scans, chemotherapy, radiation, and surgery to remove the tumor from my rectum. Routine became looking into my wife's worried eyes every day and calming my little girl after kids on the playground told her that her daddy's going to die because he has cancer. Yeah, that was my daily routine. My tip is, if all that sounds good to you, keep smoking.
Smoking can cause colorectal cancer. Screening saves lives. You can quit smoking. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
My name is Brett. If you smoke, you could get gum disease and need to get your teeth pulled, like I did. Here are some tips in case that happens to you. If you're having one tooth pulled, your dentist will probably give you a shot in your gum for the pain. Sometimes part of the tooth they're pulling breaks off. If that happens, they may have to cut away the gum and bone to get at the rest of the tooth. Then they remove it. Of course, if smoking gives you gum disease, you might have to have 15 teeth pulled at once, like I did. The pain that comes with that is just something you'll have to get used to.
You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.
Welcome back to Healthy Living with Tobacco-Free Allegheny. I'm Joyce Petro, here with our guests today, Susan Harshbarger and Deborah Kars, both nurse educators at St. Clair Hospital. Sue, could you tell us about the programs that St. Clair offers to address tobacco use during pregnancy?
Yes, we certainly encourage all women to quit during pregnancy. We also encourage their significant others and family members also to quit. We do offer group classes and individual classes. I've also done small groups if mom, significant other, or even grandma and grandpa want to quit. It is a very great gift that you can give your growing baby by quitting smoking, and certainly a gift that grandma, grandpa, or other members of the family can also give that growing baby is the gift of no smoking.
What strategies do you use to help pregnant women stop smoking?
The strategies we use are probably very similar to what we use in anybody who's trying to quit smoking. I do put special emphasis on relaxation, rewards, and support for the pregnant woman. When you're pregnant, your body is under stress. You're probably having some, mental stress just from, anticipation of the baby, worry, concern, all the things I think that go with impending motherhood. So really concentrating on ways to help mom to relax, I think, are very important. Also, rewards, I think, are very important for anyone who's quitting smoking, but certainly when you're pregnant. When you are quitting, there is often a sense that you're feeling deprived. And I think sometimes the sense can be a little bit greater when you're pregnant, just because everything else going on. So I think rewards are very important. And this is one point that I think, a time that I think family, friends, significant other can play an important role because they can offer those rewards. If you don't smoke today, I'll come over and clean your house, or I'll cook dinner, or we can go out. This is a great way and a great opportunity, as I said, for significant others, family and friends to be supportive, give rewards. I did have one mom who family and friends got together. They had actually went to the dollar store, bought like 30 little dollar items, wrapped them all up, put them in a grab bag, and for each day she stayed smoke-free, she was able to pick a little gift from that grab bag. And at the time, she had said that was just, she really anticipated that. She said it was really cute, really great, she's very grateful for it, and it worked really, really well for her. Other things I recommend is to pick a quit day. It helps because if you have that quit day in mind, it gives you time to plan. Planning is very important. You want to make a list of times, places, and emotions that make you want to smoke and decide what you can do instead of smoking. Also, if you can take some practice time to practice some of those new skills, new behaviors before your quit day, that can be very helpful. And again, I can't stress this enough, support, support, support. Talk to your doctor, family, friends, ask them to help you. The rewards are important. I had discussed those. Taking time to relax is also very important. Often when someone goes out to have a cigarette, it's like a 5 or 10 minute break. You kind of escape the world for a few minutes, and we all still need that, even when you're quitting smoking. So what I often suggest to our pregnant patients is to take 10-minute breaks. Instead of going out to smoke, just put your feet up, listen to some music, close your eyes and daydream. But take that 10-minute relaxation break. Take that little 10-minute break from reality. It is very important for all of us. Be ready to deal with cravings. We have different techniques that you can use in order to deal with that craving. Just taking a few deep breaths is very helpful. Drinking a glass of water, having a small snack, or maybe getting a little exercise, just deep breathing, stretching, maybe folding some baby clothes or going through your baby items. All those types of things can be helpful. sometimes going for a walk, taking a shower, playing a game, or just simply reading and listening to some music. If you need to, call a family member, call a friend, and discuss how you're feeling. The first few days, the first few days of quitting can be challenging. It is important to stay focused, to stay determined, and to stay busy. And if you need help, again, not being able to stress this enough, call family, doctor, or friend for help.
Okay, what about other resources in the community? Would something like the Pennsylvania Quit Line be an appropriate resource for pregnant women?
I think the Pennsylvania Quit Line is an excellent resource for pregnant women. It is readily available, something you can do from your home. I often tell anybody, pregnant women and my other quit smoking clients, that you could sit with in your pajamas with a cup of coffee or a glass of water or a snack and pick up the phone and do your counseling over the phone. The Quit Now number is 1-800-784-8669. And in particular, for pregnant women, you will get up to 10 personalized coaching sessions when you call. And I believe there are rewards for each completed session. So it's a very good resource.
That's nice. So what kinds of information or services are available to spouses or partners to help them not use tobacco around pregnant women?
Well, certainly, as I mentioned earlier, we do have programs available at St. Clair Hospital. There are many other resources throughout Allegheny County, and Tobacco Free Allegheny is a great resource for tracking down some of those programs and services. But also the Quit Line is also available for family members and friends. So, some very good resources out there.
Thank you. What information or services do healthcare providers need about tobacco use during pregnancy in order to be able to best help their patients?
Well, I think healthcare providers really need to make patients more aware of some of the risks to both mom and baby during pregnancy, and the long-term risks as well. I mean, we are all very versed, I think, on low birth weight and premature birth, and a lot of the immediate issues or health concerns we might see when baby is born. But I think really to be able to discuss with moms the longer-term effects that we are now seeing from tobacco use. I think we also need to do a better job talking about quitting, but also offering the support and resources. And again, I think having resources available like the Quit Line and Tobacco Free Allegheny are a great start with that. AGOG, which is the American College of Obstetricians and Gynecology, says that feels that because the motivation to quit during pregnancy is so great, that it does recommend that healthcare providers be very proactive in assisting women during pregnancy to quit, and even taking that a much greater step further, not just advising them to quit, but also providing them those resources to help them quit.
Deb?
Sure, and I would just add to that, I think it's interesting when Sue talks about the motivation to quit when folks are pregnant, and we hear that, I quit as soon as I became pregnant, but what we find is as soon as the baby is born, then they want to go back to it. And so if you look at from an obstetrician or the OB provider's healthcare perspective, they'll see that lady after she delivers, probably another time, and then probably for her annual exam. So pediatricians take a very active role as well in paying attention to who's smoking in the home and providing education to those families as well. I also think that it's really important, and it's coming more and more, I think, is this education related to e-cigs and vaping. And I think obstetricians and pediatricians and all the other healthcare providers that deal with our pregnant ladies and after delivery are becoming a little bit more aware, but there's a lot more education out there in terms of hazards and how to counsel folks about that. I know that we know that folks say they want to use e-cigs as a way to stop smoking or to cut back because they feel they can control the amount of nicotine that's in them. Again, they're not FDA regulated, and so we don't really know what else is added to them. We don't have long-term studies to look to see the effects of that. So I do think our healthcare providers are definitely learning more about it, but definitely more to come related to that. The other thing is, Sue and I run into this sometimes when we talk with women in different settings. They think that they can't smoke in the hospital, so therefore they may not want to seek early prenatal care because they're afraid that they'll be told, oh, you can't smoke when you're in the hospital. And that's very true with all of the hospitals in the city of Pittsburgh. Smoking is not allowed within the hospital, but there are things we can do leading up to like, for example, trying to get the lady to really cut back or quit. We can do nicotine patches when they're in the hospital. Their healthcare providers need to be discussing that with them before they get to the hospital so that they know what the plan is to manage any symptoms that they might have from the effect of not being able to smoke. Ideally, we'd love for them to quit. Realistically, that may not work for everybody, but I think it's a joint effort in terms of educating with the healthcare provider prior to healthcare providers in the hospital and healthcare providers after they leave.
And I think also we have seen in the hospital that when moms have smoked during pregnancy and babies are born, babies do go through nicotine withdrawal. They tend to be more irritable, sometimes a little bit more fussy. So, I think healthcare providers need to, kind of address those issues with mom too.
So we talked a little bit about after the baby is born. So are there issues related with tobacco use and, for instance, breastfeeding and other infant care? Deborah?
Sure. Again, I think that a lot of folks are under the misconception that they can't breastfeed if they smoke. And Sue and I do a lot of counseling regarding that because the benefits of breastfeeding far outweigh the risks related to smoking if we counsel folks the correct way to do that. Again, quitting would be the priority, but if they're not, we would recommend folks breastfeed and then have their cigarette. And you breastfeed every 2 to 3 hours, so hopefully you don't have to have another cigarette within that time. And then that way, the exposure to the baby is less by the time you go to breastfeed. A lot of our patients benefit from other resources in the community, and breastfeeding moms get other things that help them to be successful in breastfeeding when they utilize other resources within some nonprofit organizations. So there's a lot of support for folks to breastfeed. I think there's definitely a misconception that it's something they can't do if they're smoking. We also tell them they want to make sure that they have some sort of maybe blanket or something like that between them and the baby. Very close skin-to-skin contact, right, when you're breastfeeding, so you don't want the baby to be directly lying on that skin if a mom has smoked and there are toxins on there. So would you have anything to add to that?
No, I think actually you covered it very well. Thank you.
Mm-hmm.
Thank you for being with us today on Healthy Living with Tobacco-Free Allegheny. Our guests today have been Sue Harshberger, nurse educator and tobacco treatment specialist at St. Clair Hospital, and Deborah Kars, clinical instructor at Robert Morris University School of Nursing and registered nurse and community educator at St. Clair Hospital. You're invited to listen to this broadcast by visiting www.tobaccofreeallegheny.org.
I'm Christine. I'm here to give you a tip on how to eat if smoking gives you oral cancer and you have to have your jaw removed, like I did. Since chewing is kind of difficult without a jaw, and if you're like me, without any teeth too, you'll be on a liquid diet. Okay, I'm pouring it into my feeding bag. In case you're wondering, it looks pretty much like how it sounds. Here we go. That sound you're hearing is the sound of your dinner from now on, and your lunch, and your breakfast. My tip for you is don't get too hung up on choosing the flavor of your liquid diet. They all really taste the same once you put them in your feeding tube.
Smoking causes immediate damage to your body. You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.